Hi, hello. Sorry, I'm a little bit late because there was a bomb raid and we had to be in the shelter. Can we start in 2 minutes? I will go inside so we have in stable place.
Sure. Dr. Jarno Habicht, driving, in fact, from one place to another, and you just pulled over for our interview, so we can't thank you enough for this. Can you tell us a bit about where you're going and what for?
Thank you. And I'm currently in Lviv, but as we have constant bomb raids, so sorry for being a bit late because we had to be in the shelter. And this is our daily life because civilians, but then also the humanitarian workers, safety first. And that's very, very important.
Are you saying you're avoiding shelling and bombing?
We need to be in the shelter when there is a bombing. And this is when you ask about what the healthcare workers are doing. Now we see the deliveries, which are in the basements of the hospitals. We see attacks on health. We know that it's not anymore always safe to be in the ambulance. And when we look to the doctors and nurses, they also are afraid about their life because so many healthcare facilities are under attack. But what we need to do in this phase is we need to support, and that's what WHO is doing. We are currently preparing for a number of convoys. We have already yesterday got the convoys to Kiev City, Poltava, Odessa. Yesterday, very important to ensure primary healthcare support that people can treat their diabetes, hypertension. But in the big cities, shelling, most important is the trauma and surgery care that we can provide. So this is WHO's everyday's work, more than 100 metric tons of support that has been delivered with the convoys to the hospitals. And we have a number of planes landing to Poland to do it more.
The WHO has warned that the spread of infectious diseases like measles and TB may reach epidemic proportions. What are the WHO and other organizations on the ground doing to reach out for civilians in need? Give us a sense of the challenges, the practical challenges on the ground.
The practical challenges and what we do is to, first of all, to provide sufficient medicines and share them with the healthcare workers who are working. So health system is still functioning. So what is important that nurses and doctors can do their work. In those areas where there is no heavy shelling, the vaccination programs are still working. Our role is to ensure that they have enough vaccines, enough medicines to provide care. Second is to provide additional medical teams who could arrive to the western part and travel further to the eastern part to provide care. We work with many humanitarian organizations, MSF, others who are already in the field, as well coordinate within UN, as well with ICRC and other colleagues. So this is the practical work we do. So if we ask priorities, what WHO has, it's first medical supplies. Get them to Ukraine, support. Medicines, trauma kits, surgical kits, that's the first priority. Second is to ensure that there are medical teams who can provide care because healthcare workers have been providing care for the last 2 years for COVID. Many of them are tired. Many of them don't want to die in the hospital. So we need to bring additional teams in to support the care. And the third, very important, is that all the humanitarian help is coordinated and kept safe because we need to ensure that also the doctors, nurses, truck drivers who are getting all those supplies to the field are also protected. So medical supplies, more medical teams, and safety. These are the three priorities that WHO has in the last 2 weeks.